As an ear, nose, and throat physician, I see a lot of different changes with the nose. Sounds like they're having a lot of fun next door. Rhinoplasty is nasal reshaping surgery in which I address some and sometimes all of the things that show up here. Taking off a bump on the nose, repairing some drooping of the tip of the nose, sometimes improving breathing and addressing septal deviations for a deviated septum, and occasionally repairing either traumatic with people with injuries or even repairing cancers of the skin of the nose. This kind of encompasses a lot of those. Here's a woman who couldn't breathe through her nose very well. She also had a hump that I removed. Her nose kind of twisted off to the side, so brought it back into the center of the face. And looking from below, you can see she has a deviated septum off to the side and a little bit of a kind of boxy or squarish nose. So gave her more of a triangular shape to the tip of the nose. Here's another example of a hump on the nose, which she really was not very happy with. And you can see afterwards she has a nice balanced nose that really works well with the rest of the face as well. Here's a woman who is over 6 feet tall and really wanted a nose that kind of matched her profile and her face. And she had kind of a nose that looked a little more like a slip and slide. So just kind of refined it and gave her a nice, as we say, a Roman nose. Sometimes it's specific issues. So in this young woman, there was some changes of the tip of the nose and the cartilages were visible. And she really didn't like the way that it kind of had a little cleft in the center of the nose. And you can see how that just kind of reshaped and gave it a little more of a balanced appearance. Another example of removing a little hump on the nose, lifting up the tip where it had come down. This is a term we sometimes would make called a witch's nose. And it can really make a big difference in someone's appearance because the best nose fades into the background and doesn't really draw much attention. From the front, you can see that it just kind of softens her face, brings out her eyes and her smile. Sometimes an injury to the nose. Here's a young male who was struck in the nose and it broke it and just brought his nose back to the way it used to be. I think you can see how the whole nose was shifted off to his right, and afterwards brings it back into the center. He can breathe much easier, and sometimes I even combine those things. So this was a young woman who you'll see on the next picture had broken her nose from falling off a horse, still had some bruising under her eye from that injury, and at the same time we softened the nose, brought down the hump, and combined that with the repair of the injury. Occasionally people are born with either a deviated septum or a deformity of the nose, and here's a young woman who was able to bring that nose back into the middle and allow it just to really fade into her face so you didn't see the nose, and all of a sudden you see the rest of her really nice features. Another thing that can happen is there are injuries from prior surgeries. Here's a patient who had had a rhinoplasty procedure 18 years previously and really had lost much of the support of the nose. So I actually took some cartilage from her ear to rebuild the nose and give her at least a nose that didn't look twisted and abnormal. Here's another example of a nose that was injured in a trauma and was rebuilt again with cartilage borrowed from elsewhere. Any questions about rhinoplasty procedures? Certainly some of the more challenging cases that I do because each nose is so different from every other nose. Here's another kind of fun one that I'll show you a few pictures. It's called otoplasty, and many people are surprised when I say, oh yeah, I did a cosmetic procedure on a 5-year-old. But occasionally this is something I do for patients who are adults as well. Here's a woman who really was bothered by the fact that her ears stuck out, and that was what really drew her focus. And I think the picture speaks for itself about how happy she was after having her ears pinned back. It's a great question. So this type of procedure, I make an incision behind the ear, and I reshape the cartilage of the ear to give it the normal twists and turns and shape and projection, which is how far it sticks out away from the edge of the face.
It makes it lay down more.
Exactly. So you can see just what a dramatic change that can make in a young person's life. Here's a young male who really would never open his eyes for pictures, so we just let him keep his eyes closed. And he actually suffered from pretty severe OCD, and this was something that really he would focus on. So this made a really big change in his young life to allow him to not really get the attention that he really didn't want from his classmates from a negative standpoint. This is just one of the most adorable young girls, and she really lived up to exactly how she appears. And afterwards, you can see just how pleased she was to have her ears pinned back.